Firstly, take us around the grounds. Where are we at with this great vaccine race?
Yeah, g'day Michael. Well, let's just start with the national picture of how many doses are actually going into arms every day, and that curve is still increasing. 307,000 doses done yesterday. I think New South Wales was a little bit lower, reported yesterday. New South Wales was a little bit lower because that's the number of doses on a very rainy day in Sydney, so I suspect that may have had some impact on the individual one-day kind of total, but this is what that turns into on a 7-day average. 265,000 doses going into arms every day, a number that we wouldn't have dreamed of back in February when this started and looked so rocky for so long. Let's just have a quick look at the state-by-state totals though, because obviously these doses are going into arms in very different patterns across the country, and we've had the two kind of fastest states and territories. There's been this tussle going on for the last week, the ACT and New South Wales day by day kind of attempting to stay ahead of the other. Yesterday New South Wales took the lead in this race, if we're going to use that metaphor, of the 16 plus population. 61.5% vaccinated with a first dose, 61.2% in the ACT. So they're the ones that are kind of most progressed. We'll probably actually get to 70% first doses next week, while some of the other states have got a fair way still to go. And some of these, I should say, because of the patchy nature of the regional kind of divide between some parts of the country, even in a place like Queensland where you've got 47.6% of people with a first dose, we've got some really stark geographic divides. The kind of lowest vaccinated parts of the country, well, Queensland, regional Queensland particularly, really over kind of represented in that, right down the bottom of the list in terms of coverage of places like Mackay, the Whitsundays, central Queensland, and also parts of southeast Queensland like Logan and Ipswich. And we really, you know, this is not about protecting people in the cities. We need everyone to have the same level of protection by the end of the day. When we come to open up, that is one of the things that you need to kind of be comfortable with, is that you've got relatively even vaccine coverage. So there's a bit of catching up in some parts of the country, some parts of certain states in particular, that needs to be done.
Yeah, so a lot of the countries further ahead in their vaccine rollout, Casey, have seen a slowing in their pace. Is it likely Australia will get to phase B and phase C without seeing vaccinations starting to slow down?
Yeah, that's the million-dollar question, isn't it, Michael? Let me show you a few things and a few countries to kind of give you a sense for how this rollout has gone in other places. And what I'm going to do is compare Australia to some other countries. So I've converted our 70 and 80% targets of 16 plus population to the percentage of the whole population. And so in that case, phase B is about 56% of the population, phase C is about 64%. You can see Australia speeding up there on about 43.6%. This is since we hit 1%. So now the question is, what kind of country, what kind of trajectory are we going to look like into the future? And the point I want to make is we are really in charge of our own destiny here, because you look at a country like the United States, which ramped up relatively quickly in sort of January, February, got to only kind of 30-40% before it started to taper off. It's crossed the equivalent of our phase B trigger, not even yet at our phase C trigger. So this is one of the examples people look at and go, you're going to see a slowdown in the pace of vaccinations. But it's not been the case in every country. United Kingdom, again, it saw a slowdown. It has now exceeded our phase C trigger. So do we look like a country like the United States or the United Kingdom? Do we look more like a country like Canada, where you've seen a really rapid growth all the way up to the phase C trigger, and only after that, only after the equivalent of 80% of adults, are you seeing that tapering off and that plateauing? Do we look like a country in Europe where you see a similar sort of situation? This one's France, where the curve has really kind of increased at a relatively steady rate and zoomed straight past the phase C 80%, or Germany, where it's slowed down at about 70% but has still got there. And there are lots of different dynamics at play here, lots of different settings. We have very high kind of childhood immunisation rates in Australia. That would hopefully put us in good stead to have really high adult COVID-19 vaccination rates. And also, we're a country where, the targets, our freedoms going forward are very much linked to these vaccine targets. And in some of the countries, like France, where we've seen, real freedoms attached to getting vaccinated, like you can't go to a restaurant unless you're double vaccinated, we've seen that kind of surge continuing, way past the sorts of levels that we're currently talking about for phases B and C. So I think our destiny is in our hands in many ways. We don't have to look like the United States curve. I suspect that we'll have no trouble getting to 70%. Maybe we'll see some slowing before we get to 80%, but I don't suspect we'll have much trouble.